Last week was hospital week, and it was fun to see so many of you at the various events and to see how many people participated in all the prizes and the good things that we did. I didn't get to be a part of some of the events because I was out of town at my son's college graduation for the first part of the week. I wished I could have seen more of you, and I'll look forward to seeing you around the hospital in coming days. I also want to share about our new partnership with UC Davis. Some of you may have seen the article in Lodi's paper about the partnership. I'm so proud of the good work we're going to be doing on behalf of our smallest patients in our level 2 nursery that's going to start this summer, as well as the pediatric coverage for the whole house and our emergency department. You will hear more about this new added benefits to our patients here in the coming weeks. Also want to share about the discharge value stream mapping process that happened last week with the Karen Martin Group and many of our team members who are designing ways and thinking through the processes on how we discharge our patients so that we can make that more smooth for the patient and for our team members. Ask one of the folks who participated from care management or nursing. Some of our leaders were in that group. Those people could tell you about this process. This is part of a lean thinking program that we're doing with our leaders and all of our staff to make our organization and our processes better for our patients and better for our staff. The last thing I want to share about is a story from Christiana, our patient experience liaison. I've asked her to share this story in her own words.
I'm Christiana. I'm our patient experience associate, and I have the pleasure of rounding on patients daily. And one of the really amazing parts about that is that I get to make some meaningful connections with patients and hear what they really think of our hospital and our organization. And I met a patient named Susan last week on 2 South who had such pep in her voice, and when I asked her why, she said, "How could I not be happy? I have a single room, I have a beautiful view, and I'm just very blessed to be here." She continued to tell me that she's been in our hospital 6 times due to a recurring health issue, but that if she were to give us an average grade for all those 6 visits, it would be an A+. She mentioned how the nurses, they praise her when she even just lifts her leg, which makes her feel really special, and she kind of jokingly told me about it because she said, "It's such a little thing, but they make me feel so great about it." And then when I asked her about her stay and just how everything was, she said, "We have a clean facility. We truly care about her." She also told me, when I asked if there were any staff members that stood out for their excellent care, that our patient advocate that visited the day prior, named Judy, was amazing, that they had a great conversation, and that we're fortunate to have volunteers that have such a strong community presence and that she can visit her anytime. So I was really happy because I got to write a thank you card for one of our volunteers when mostly I get to write them for nurses and doctors, so it was a nice change. This was an excellent experience for me, but this is a regular occurrence. I always get to meet patients, so many patients that are happy with our care and the work that you do, and so I just want to thank you all for that.